Namaste, I am Dr. Nischal, practicing as a consultant dermatologist at Nirmal Skin and Hair Clinic, Vijayanagar, Bangalore. Heart disease and skin. See, any alteration in the internal system can reflect on the skin. See, skin is an index or a mirror of your internal health. So, any organ, it can be an endocrine gland like a thyroid, or it can be kidney, or it can be heart. Anything can give rise to skin changes. But identifying or pinpointing the skin change directly to an organ may not be always possible. But what happens when there is a heart problem? The biggest challenge is whenever your heart is not working properly, the pumping action and the blood flow is not so great. So when this happens, naturally the nutrition to the skin gets affected. So whenever the heart is not pumping properly, the earliest thing is there is swelling in the feet. Whenever there is swelling in the feet, the skin is stretching. Because of the stretch, there can be lot of dryness, there can be fissures or cracks in the skin, and this can give rise to either itching or mild burning sensation. When this dryness or the fissuring is not taken care, then it becomes an eczema, and this eczema gives rise to a lot of redness, it can give rise to burning sensation, there can be oozing of fluid. And whenever this eczema happens, there is a lot of bacterial colonization and it can give rise to infection. So that is the cellulitis or furuncle or boils can happen. So this is one of the things which happens with a heart related issue. Second, what happens is whenever the heart is not functioning properly, there is a lot of tiredness. So there is a lot of weakness, and this weakness makes a person to be very fragile and fatigued, and because of that they are not able to take care of their skin regularly. This leads to a lot of dryness and flakiness of the skin. So this can give rise to itching and redness and inflammation in the skin. Not only that, the circulation in the intestine that also gets affected. Because of the edema which happens inside, the absorption of nutrition does not happen. Whenever there is malnutrition, there is a lot of scaling which can happen because of these vitamin deficiencies. We call it as dysebesia. There is a lot of scaling which happens around the nose, here around the mouth, sometimes the ears, back of the ear. It can happen even in eyebrows. It looks something very similar to dandruff reaction, and it can also predispose a person for a lot of eczema reactions. That's called as pellagra. There are a lot of rashes on the skin, especially in the sun exposed part it happens. So these type of changes happen with the skin whenever people have some heart related issue. See, it's not a direct association that the heart is giving rise to this type of an infection, but whatever the damage is being caused by the abnormal blood flow can give rise to other skin conditions and give rise to infections and eczema reactions. Whenever the nutrition is affected in general, even not only the skin, the hair and the nails also get damaged. The nails can develop a lot of striations, the nails become very fragile, they tend to flake off. There can be even discoloration. There is a lot of aggressive hair fall, the hair becomes thin, sometimes the hair color also starts changing and the texture of the hair starts getting altered. The hair which was thick starts becoming fine and soft. So the changes can happen at the level of the skin, hair and nail. All these three things can happen. So anytime you see some change in a skin which is drastic, sudden, it's better to consult a doctor.